I'm Deb Gordon, and I am a social worker here at Hospital University of Pennsylvania, and I work with the heart failure, transplant, and the VAD program. I am inspired as a social worker to be involved in a very intense time in their life on the pre-transplant side, and then to be able to follow them through the spectrum of care 15, 20 years later, and to be able to see their hopes and dreams come true right before my eyes. It's quite rewarding. The transplant process is incredibly overwhelming for every family. It's most important for them to have some education, but also the emotional support is imperative for future positive outcomes.
Anybody who's worked with transplant knows that it's a very special population with needs different than most. It encompasses their whole life. Their transplant lasts their whole life, and it's not easy to maintain a transplant. One of our physicians used to say it takes a village, and Debbie's kind of the leader of that village. She has tremendous insight into the patient's psychological well-being and needs. I mean, I would never meet a patient without first reading Debbie's evaluation of the patient.
She is truly an extension of our medical team. Not only is she knowledgeable about the medicine, but she also has an amazing ability to connect patients to services, to identify their needs, and then find creative ways to solve them.
She can have very difficult problems to solve with a family, and she just puts her head down and starts working. And the families know that. She never says no, and she doesn't give up. And that's really, I think, unusual, and it's what makes her so special. Any of the transplant programs, we'll call her, say, we don't know what to do, where do we even start? And she always has a place to start, and some way to look at it maybe differently to solve a problem.
She's never turned down a challenge, and she's had many, and it's made a big difference in patients' lives.
Deb Gordon and all of our social workers are a critical component of our transplant team. We could be perfect medically and surgically, and patients could still have a bad outcome if they can't connect to the right services, take their medications, and have the support that they need.
Deb's role to the transplant team is absolutely invaluable.
Counseling support, mindfulness, meditation, deep breathing, sometimes that can just save the day in getting through a really difficult moment. Sometimes it's just sitting in silence and holding their hand while they're in the hospital and very frightened. Sometimes it's playing some loud music, their favorite song, and maybe dancing or having a party, celebrating. If I have someone in the hospital for a really long time, we bring family in. We create that family atmosphere here. My group is able to provide that level of counseling support, concrete assistance, and have a vision for the future. And we establish a plan from that first meeting that can really step 10 to 15 years into the future.